Hello everybody, my name is Charlotte. I'm a dental hygienist and I'm here today to talk to you guys about type 2 diabetes and the effects that it can have on your mouth. This oral systemic link is very strong, and dental hygienists especially have a unique opportunity to not only identify certain medical conditions and help get people to doctors for correct diagnosis, but also when patients have medical conditions like type 2 diabetes, we can help to relieve some of the symptoms that are associated with that and help our patients live longer, happier, healthier lives. So diabetes, type 2 diabetes is the most common one. And we can get into all the nerdy facts about it, but essentially when there's sugar in your bloodstream, normally the fat and muscle cells, the tissue, those individual cells will absorb that sugar, use it as a fuel, and get it out of your bloodstream. So oftentimes if there's some fatty tissue that's blocking the channels where the sugar would come into the cell, those receptors get blocked, sugar can't come in and get processed, and so the cells, those individual cells, actually start to starve, and so your body's reaction is to tell the liver to produce more sugar. Your bloodstream gets saturated with sugar, and here your pancreas makes insulin to try to open up those receptors. Receptors won't open because they're blocked, so there's this whole process where you go into hyperglycemia. You have too much sugar in your blood, and that can be extremely dangerous. So essentially, especially when you're diagnosed with type 2 diabetes, you may take medications to help control that, but there are a lot of side effects that show up in your mouth, such as dry mouth. And dry mouth, when you don't produce enough spit, your mouth is not coated and protected, so that also increases your risk for cavities, for periodontal disease, for fungal infections, yeast infections. Sometimes diabetic patients will actually get a burning sensation. It's very uncomfortable, and have difficulty swallowing and eating the foods that they like. And diabetic patients also have the sense that they need to frequently snack during the day, and that can also put you at risk for cavities, just giving the bacteria in your mouth more food to grow more bacteria. So you can see how just this diagnosis, this condition, can put you at risk for a lot of other situations that come up in your mouth. So it's very, very important to keep the bacteria in your mouth at a minimum. So just the basics, brushing very well at least 2 times a day is essential. Sometimes 3 if you have a real dry mouth because the spit's not cleaning your teeth off. So brushing 2 to 3 times a day with a soft brush, with a toothpaste that has some minerals in it to help coat and protect the enamel on your teeth. Also flossing or using interdental brushes, cleaning in between your teeth very well and getting those bacteria out from under the gum line, because brushing is not going to do it. Brushing your teeth only gets about half the plaque germs in your mouth, and so scraping your tongue, rinsing your mouth out with water, is going to be essential to keeping your mouth plaque free. Because what happens is you've got to remember, when you've got type 2 diabetes, your immune system is also not working as well as it should. So if you've got an overload of germs in your mouth, each time you swallow and chew, those germs have the potential of getting into your bloodstream and causing inflammation throughout your body, therefore creating more plaques in your bloodstream, increasing your risk for more fatty tissue to grow, therefore blocking the cells from processing the sugar. It's just this whole cycle that can be really destructive to your body as a whole. So obviously, my favorite products that I talk about on my website and that I've talked about on previous YouTube videos is because I know they work really well for keeping your mouth very healthy, and they're not as technique sensitive. So my favorite things for keeping your mouth super healthy, and I am a brand ambassador for Burst Oral Care, so that's the first one I'm going to mention, and I want to be very transparent about that. But essentially a toothbrush that isn't as technique sensitive and has a timer on it and has the sonic vibration to destroy the bacteria in your mouth very quickly and very effectively. That's number one in my book, is having that tool at your disposal to help you brush your teeth as best possible. And I have found consistently that the Burst Sonic toothbrush will do that for you. And then, like I said, you've got to clean in between your teeth and down below the gum line. So little proxy brushes, floss that's got some texture to it. Like the specific product that you use to clean in between your teeth is going to change based on what type of dental work you have, based on your dexterity, based on your preferences. They've got flavored and non-flavored items. So if anybody wants some specific advice on the product that you should be using, feel free to leave a comment or send me a private message, and I'll help you figure out what's the best for you. But brushing your teeth really, really well, at least 2 or 3 times a day, and cleaning in between your teeth with your favorite tool, those are key to being successful with keeping your mouth clean. And drinking a lot of water. You have to stay very hydrated. There's lots of other tips and tricks that I have. Feel free to browse the website, www.charlottesmiled.com. That's it for me today. Thank you so much for listening. And like I said, if you ever have any questions or concerns, feel free to reach out. That's what I'm here for. Thanks, guys. Have a great day.